All right, in this audio lecture, we're going to be continuing our discussion of conditions affecting urine elimination, focusing on congenital disorders here. So, what is a congenital disorder? You should already be fairly familiar with this from the cardiovascular section, right? These are going to be anatomical malformations present at birth. And so oftentimes we see them affect both the urinary and reproductive systems. This is collectively called the urogenital system, right? So here we get both systems generally being affected at some level. Here in this image over here to the right, we have several examples of this anatomical malformation. So kidney development begins about the 5th week, and so it's highly susceptible towards teratogens or any kind of disturbance in development, right? So it's really before you've identified that you're already pregnant, so you might be carrying on life as if you weren't. Well, you're exposing your fetus to all those life events as well. Okay. And the 20 to really 60%, 70% of development, we see a lot of organogenesis occurring, and meaning development of organs. And so we get really environmental effects having very large effects, very significant outcomes on this period of time, especially when the heart is forming, when the kidneys are forming, when the lungs are forming. Okay. So we know that the disorders can span a wide range, and meaning you might experience anatomical displacements. So like if we look at this example, okay, we have an extra kidney here. Maybe we form something like this, and we form 2 different kidneys. And so here we have a pelvic kidney, and then over here we have where the kidney is normally located, and this is going to be much superior to this. Sometimes we have 2 kidneys on one side. Sometimes we get 1 kidney. Okay. Now we could get severity based on the type of malformation that is actually occurring, right? So sometimes we have 2 ureters, and we'll have that condition showing up on the next slide in a specific example of it, but we get ureter displacement, meaning ureters can really start from the same kidney, okay? And that doesn't impair function too much. Sometimes we have agenesis, right? So agenesis meaning it doesn't develop. And so if we look over here, here's agenesis, right? So meaning we've only developed 1 kidney, and then we have the 1 ureter draining that kidney, but this side is not productive. Okay. Sometimes we see the underdevelopment or hypoplasia, right? So this would be an example of hypoplasia, renal hypoplasia event, meaning the underdevelopment of the kidney. Okay. So we see a wide variety of these disorders. Okay. And these disorders can substantially affect proper fetal development. Specifically, so the amniotic fluid is largely fetal urine, right? So, and they drink this, right? So they undergo this drinking mechanism. And so changes in this amniotic fluid volume can lead to other birth defects. And so really maintenance of this amniotic fluid level is really imperative towards proper fetal development. We could see that like I said before, the severity is kind of dependent on the malformation that has occurred. And so here's the ectopic ureter. So this is multiple ureters originating from 1 kidney. Okay, and so we see 2 ureters. That is not life-threatening. Okay. Now the agenesis is a severe condition. So if it's unilateral, you can survive on 1 kidney. Now, the bilateral renal agenesis is very severe. Obviously, you don't have any way to filter your blood. Okay, so A means without, formation. Genesis means the formation. Okay, so without kidney formation, and depending on the level of the agenesis, it's going to impact the function. Right? And so there really isn't a treatment for these congenital disorders. We just see that individuals who maybe only have one kidney have to modify their lifestyle choices a little more frequently, and it depends on the presence of accessory structures like blood vessels. Okay, here in this bilateral agenesis, my guess is a child born without any kidneys would have a low survival rate. All right, until next time.